Thank you very much, Mr. Chairman. It sometimes feels like we talk about the COVID-19 vaccine requirements as if they were the first vaccine requirements to ever exist in this country. Vaccination requirements, including in the military, have had a long and storied history. All the way back to 1777, General George Washington required his continental troops to be inoculated against smallpox. General Washington wrote at the time, "Necessity not only authorizes, but seems to require the measure." I think General Washington had a point back then, and I think his point is valid today. And again, none of this is new. Before COVID-19, the military already required a long list of immunizations, including shots to protect against polio, influenza, hepatitis B, and the measles. And the list of legal precedents supporting vaccine requirements is long as well. In 1901, a smallpox epidemic swept through the Northeast, and Massachusetts required all adults to receive smallpox inoculations or pay a $5 fine. A resident sued, arguing that the requirement would violate his due process rights under the 14th Amendment. And in Jacobson versus Massachusetts, the Supreme Court rejected those arguments, holding instead that the state's power to protect the public health of its residents prevailed over the individual's right to refuse vaccination. Again, in 1922, the Supreme Court held that cities could require students to get smallpox vaccines before attending public or private schools. And then, of course, in 2021, the Supreme Court allowed Indiana University to require vaccinations as a condition of attendance, a decision that was authored by Justice Amy Coney Barrett, not exactly a liberal. So I don't see much of an issue here as to whether vaccine requirements are constitutional, with some exceptions, and we'll talk about those in a minute. But almost 120 years of precedent demonstrates that they clearly are in the main. Dr. Lynch, could you put vaccine requirements into context for us? There's no question that COVID-19 was the highest profile example of vaccine requirements in modern history, but how have vaccine requirements been implemented in other eras with respect to other diseases?
We, in fact, have a long history of requiring vaccinations in the United States in different populations. Two additional examples to your own include influenza vaccine requirements for healthcare workers, which I've already spoken about are highly effective in getting vaccine uptake and protecting both patients and healthcare workers, and school entry vaccine requirements for children. We also have a long history, just to be clear, of looking at exemptions from both medical and religious perspectives for individuals with those challenges. I believe this balance has worked very well in all of those programs.
And how have these vaccine requirements traditionally accommodated medical and religious exemptions?
There have been good documentation of appropriate medical exemptions for different vaccines. These are laid out by various public health authorities, including the CDC, as other and international bodies, and those can be easily documented by both physicians and other healthcare staff. In terms of religious documentation, there's been a clear precedent around sincerely held religious beliefs and maximizing the potential for accommodations for healthcare workers and other individuals in those populations.
As a physician, do you find that there's any clinical reason for you to be concerned that the safe and effective COVID-19 vaccine was previously required during the pandemic, just as other vaccines have historically been required to keep people safe and to protect our public health?
I have no concerns.
Thank you, and I yield back.